My name is Keith Fletcher. I'm the CEO of MyPrac Proprietary Limited, which is a practice management company that manages 4 general practice facilities. COVID's affected our practices like it has every Australian, I think. It was extremely difficult on everybody. There was a lot of thinking on our feet. We had a lot of senior meetings led by the GPs themselves and the nursing staff, implementing change, and then it felt sometimes an hour later we were having to change those decisions. It had a tremendous impact on everybody involved. Well, the Respiratory Clinic is one of 100 across Australia. It was set up right at the pointy end of the pandemic, and the focus was on testing to be able to identify any outbreaks. At the start, we were seeing maybe 20, maybe 30, but as outbreaks have continued, we're seeing up, over 80 a day at the moment, and so that's a lot of pressure on those clinicians and administrative staff to keep doing that day in, day out.
The respiratory clinic that we have established here is a Commonwealth-funded, contracted arrangement with general practice. We're up over 2,000 tests at the moment in that 14 weeks, and it's certainly getting busier and busier. Initially, the contract was taken on by Dr. Thevashanga and myself, and that meant that we were basically working half a day each every day in the respiratory clinic with our wonderful nurses as well, and our admin staff. And that obviously was a really difficult thing for both of us because we work full time, but we both made the commitment very early that that would be okay. And I think for myself and some of my colleagues, this is our national service. This is our opportunity as medical and nursing professionals to have to step up for our country and for our communities.
I wanted to volunteer is because I came from a country which underwent war for last 30 years. So I'm used to this war situation. I see this COVID is a war. And so I was able to give my share of experience that I gone through. I thought it's pretty much that you prepare for a war and how do you manage yourself and to thrive and to be still happy. And so we do have a lot of changes according to COVID, and we are coping well.
One of the things that we found in the practice is that everybody has been affected very differently by coronavirus. So we have regular discussions about how we look after each other and how we make sure that nobody is hanging out on the edge, needing a bit more TLC or a bit of time off or something like that. I think one of the lovely things that has happened, certainly what the Department of Health has enabled us to do with things like telehealth, is to actually have a personalised, designed way of practicing for each of our doctors. Some of our doctors work face-to-face some days, they might work just telehealth. We're able to wear masks or not wear masks depending on the decision that we make about the risk for that. We've been able to get our patients to stay in the car, just come in when they're needed. We're having to be sensible about how we interact with people, how we distance our patients, how we educate our patients. And that's what general practice is about. It's about educating people to keep them safe, keep them healthy.
The staff really have rallied. When you look at the broader picture on just how important general practice is to the foundation of healthcare in our communities, their being solid is just more than commendable. It's outstanding. And they kept our community safe and they kept each other safe.